The U.S. Surgeon General is declaring that raising children in America is causing an unsafe level of stress in parents. A new study finds that nearly half of all parents say that on most days, their stress is completely overwhelming. As a father of two, I can relate. Joining us now, U.S. Surgeon General Dr. Vivek Murthy. He is recommending several new policy measures to curb parent stress. Doctor, thank you so much for being with us this morning. My jokes aside, this is a serious issue. Walk us through what you found. What can parents do about it?
Well, Jonathan, you're right. This is a serious issue. Right now, there are millions of parents who are struggling in the shadows, and we need to pull back the curtain on what they're going through and provide them with some much-needed support. You know, in my work on the youth mental health crisis, I was having conversations with families across the country, and one of the things that became quickly apparent is that parents themselves were also struggling. And as I dug into the data, it became clear that 48% of parents are saying most days they feel completely overwhelmed by stress. They're also telling us that they are struggling with loneliness in the numbers that are significantly higher than other adults. You put those two things together, and you have a recipe for the mental health strain that we're seeing on parents today. And Jonathan, that has real consequences, not only for the health and well-being of the 63 million plus parents out there, but also for others. Keep in mind, the mental health of a parent affects the mental health of a child, and we all have a vested interest in ensuring that parents and children are well.
Dr. Murthy, what can be done, though, in terms of public health, public policy interventions and strategies to help here when you look at the child care crisis in this country and the lack of affordable, consistent, easily accessible child care is something that I would say most parents in the country deal with on a day-to-day basis.
Absolutely. And look, and as a father of two, my wife and I have struggled with that challenge as well. I think many, let's look at where this is coming from, these challenges. And it's important just to say first off the bat that parenting has never been easy, right? For generations, parenting has had its share of challenges. Finances have been a worry for parents. Safety has often been a concern. Figuring out how to manage teenagers has been a perennial concern and challenge for parents. But there are some new challenges that parents are dealing with now that prior generations didn't have to. For example, managing social media and phones in your kid's life, dealing with the youth mental health crisis and loneliness epidemic, which has hit kids particularly hard. And keep in mind also that many parents are worried about gun violence in their communities. We know that half of kids, more than half of kids, are saying they're worried about shootings taking place in their school. All of this weighs on parents. And when you compound that with what has become this very intense culture of comparison that we are living in, that's fueled by online trends and social media, where parents are constantly comparing themselves to others and feeling like they're falling short, all of that leads to the stress that parents are dealing with today. But here's the good news. There is something we can do, but we've got to move quickly. Like on a policy level, we need to pursue measures like paid leave so parents can be with a sick child, for example. We need affordable child care. We need consistent, accessible mental health care for kids and adults. And we've got to address the harms of social media, address issues like gun violence, which contribute to the stress and strain on parents' day-to-day lives.
Dr. Murthy, Molly Jong-Fast here. I'm curious, can you speak to us about what part tech regulation could play in helping parents take care of their children and sort of, you know, with the mental health component?
Well, Molly, the most common question that I've been getting from parents all across the country has been actually about technology, and specifically, they are worried about the impact of social media on their kids. And there's good reason for them to be concerned. I detailed much of this last year, actually in a Surgeon General's advisory on social media and youth mental health, where I pointed out that there are serious harms associated with social media use among kids. But the key thing is that parents have been left to manage this entirely on their own. Even though they didn't grow up with social media and the platforms are evolving rapidly, this is a place where Congress really needs to step in and put in place the kind of safety standards that will protect kids from harmful content, from bullying and harassment online, from exploitation, and from manipulative features that seek to lure them into excessive use.
So, Mr. Surgeon General, I want to shift gears here and talk to you briefly about the COVID pandemic. Just a few stats right now. The Center for Disease Control and Prevention has reported high or very high levels of the virus in wastewater in just about every state in the nation. The rate of hospitalizations for COVID nearly twice at the level it was this time last summer. And deaths, so certainly well down from the height of the pandemic, are still double from where they were this spring. And just anecdotally, it feels like half people in my life currently have COVID right now. What can people be doing about this? I know there's a new booster on the horizon, but also what degree of concern do you have? Obviously, we're in a different phase of this pandemic than a few years ago, but with cases this high ahead of the fall and winter, which is when normally they spike, how worried are you?
Yeah, well, certainly it's the case that we're seeing, this increase in COVID cases, in recent months. But here are a couple of things to keep in perspective. One is that we are certainly at a much better place now than we were a few years ago when this pandemic first began. And we are because, number one, cases are much lower than they were in those early days. We have treatments now, including Paxlovid, which are very effective for not only treating the acute symptoms, but reducing the risk of downstream complications. And we have a vaccine that is being regularly updated based on circulating variants. So what's important for people to know is that while COVID is not going to disappear, it is endemic now. It is going to be a part of our lives like influenza, like the flu. It is important to protect yourselves by staying up to date with your vaccines, by making sure that if you are in fact, having symptoms of, like fever, chills, sore throat, which can mimic the symptoms of the flu, that you get tested, and tests are now much more available, certainly than they were early in this pandemic. And finally, if you do have COVID, making sure that you're taking appropriate precautions to not expose others, staying home, and making sure that you are protecting, especially folks who are immunocompromised from exposure, that can go a long way to helping. But Jonathan, I think it's just important, one last thing for me to point out as we talk about parents here, is that, COVID obviously has been a huge source of stress for parents. I remember those early days in the pandemic, homeschooling our kids and trying to manage work, and millions of parents were struggling with this. But one of the most important things I want parents to know about the recent advisory that we put out on parental stress is that the well-being of parents really does matter. I know that for parents, it can often feel selfish to invest time into taking care of yourself or into just taking a moment to breathe when you have such a long to-do list and your families need so much. But I want parents to know your well-being matters and you are not alone. This is a time, even though many of us have lost our villages, where we now need to reach out to one another, share our challenges and struggles, and recognize there's no shame in having a tough time as a parent. But if we can help each other, reach out and be there for each other, we can go a long way toward helping to address some of the challenges and strain that parents are experiencing right now.
Really important. U.S. Surgeon General Dr. Vivek Murthy, thank you for joining us this morning.
Thanks so much.